This chapter covers the PEEP titration app of the Gentle Lung Suite. It is only available with NKV 550 and NKV 440 ventilators.
This video is not a substitute for training on the ventilator and assumes the clinician has read and understands the operator's manual.
As part of the optional Gentle Lung Suite of Nihon Kohden's ventilator system, the PEEP titration app is a tool clinicians can use to titrate PEEP level of a patient's lungs. Typically, the PEEP-T maneuver is a continuation of the recruitment maneuver. PEEP-T can also be used independently from the recruitment maneuver. At the end of PEEP titration, the clinician may choose to perform a recruitment maneuver. The PEEP-T app may be used on patients who are on ACMV or SIMV modes of invasive ventilation and weighing 25 kilograms or more. The maneuver is not available while in SPONT mode. To begin, locate the PEEP titration app in the Apps panel. Tap on the PEEP-T app to open the application. When patient data is available, a window displays warnings, prompting the clinicians to review prior to starting PEEP-T. Tap the arrow at the bottom right corner of the display window to continue. The PEEP titration app may be used in invasive ventilation therapy. The clinician may continue with default settings or change settings at the setup screen of the PEEP-T application. Tap on each required control setting to change the value. Use the rotary function of the encoder knob to deviate from the default setting, and press the encoder knob to confirm the change. Enter delta PC, or tidal volume, IE ratio, respiratory rate, and FiO2. Enter the duration of each PEEP step, decrement of each PEEP step, and minimum PEEP. When transitioning from recruitment maneuver, the starting PEEP is the ending PEEP from the RM to prevent de-recruitment of alveoli during the transition. If PEEP-T is used independently from RM, the starting PEEP is the current set PEEP. A graph is visible to allow the clinician to preview the maneuver. Once done, tap on the Start button to begin the PEEP titration. The ventilator will begin PEEP titration based on the clinician's setting. A new window will display a time progress bar that shows the total time and elapsed time of the PEEP titration. The clinician may end the maneuver at any time by tapping the End button to cancel the PEEP-T, and no results will appear. The top window displays a PEEP time-based graph to show the progress of PEEP titration. The second time-based graph below is defaulted to show estimated compliance. This graph can be changed to show another parameter if desired. Refer to the operator's manual to change the second time-based graph to other than the default display. When the PEEP titration is complete, the ventilator will resume normal ventilation with the current PEEP setting. A new window appears with results of PEEP at the highest compliance. This PEEP was the measured PEEP at the highest compliance level. A vertical cursor appears on both graphs, along with the measured values for the current cursor position. Clinicians can move the cursor using the encoder knob to view measured results throughout the PEEP titration maneuver. The clinician may choose to end the PEEP titration by pressing the End button or tapping on the Go to Recruitment maneuver button to proceed with RM. When choosing to end the PEEP titration maneuver, PEEP is returned to the current PEEP setting. This concludes the PEEP titration chapter.
Thank you for watching.